Introduction. In the vast world of feline diseases, one stands out not only for its complexity, but also for its potential severity: feline infectious peritonitis, or FIP. This systemic, immune-mediated viral disease has puzzled veterinarians and researchers for years. Today we'll dive deep into understanding this ailment, its causes, its manifestations, and the challenges it presents. Definition: FIP is a systemic, immune-mediated viral disease that affects cats. It sneaks up insidiously, marked by a persistent fever, pyogranulomatous tissue reactions, and exudative effusions in body cavities. The outcome: a high mortality rate that leaves many cat owners heartbroken. The virus behind the disease. At the heart of FIP lies the feline coronavirus, or FIP. This term encompasses two main strains: the feline enteric coronavirus FIP and the feline infectious peritonitis virus FIP. FIP is a common and highly infectious strain that replicates in the intestinal tract. On the other hand, FIP has a more sinister role. It infects monocytes and macrophages, cells that play a crucial role in the immune system. These infected cells then spread the virus throughout the body, with a particular affinity for the walls of veins and perivascular sites. Pathophysiology. Understanding FIP requires a deep dive into its pathophysiology. The disease is immune-mediated. This means that the cat's immune system plays a role in the progression of the disease. The virus-infected macrophages accumulate around blood vessels, leading to inflammation in various organs. This inflammation is pyogranulomatous, a specific type of inflammation characterized by a mix of active immune cells. Systems affected. FIP is a multisystemic disease. It doesn't discriminate, targeting multiple organs and systems in the cat's body. Pyogranulomatous or granulomatous lesions can appear on the omentum, the serosal surface of abdominal organs, within abdominal lymph nodes, and even the submucosa of the intestinal tract. But it doesn't stop there. The nervous system can also be affected, with vascular lesions appearing throughout the shins, especially in the meninges. The eyes and respiratory system aren't spared either. Cats can develop uveitis, chorioretinitis, iritis, and lesions on lung surfaces, leading to pleural effusion. Incidence and prevalence. FIP is widespread, especially in multi-cat facilities. However, the actual incidence of FIP is relatively low, especially in single-cat households. But when it does strike, especially in breeding catteries, the results can be devastating. In endemic catteries, the risk of a FIP antibody-positive cat developing FIP is usually less than 10. Geographic distribution. FIP is a global concern. It doesn't matter if you're in North America, Europe, Asia, or any other part of the world. FIP can be a threat. Signalment. While all cats are susceptible, some are more at risk than others. Certain bloodlines or breeds may be more prone to the disease. The highest incidence is seen in kittens aged between 3 months to 2 years. Signs and symptom. The manifestations of FIP are varied. They depend on the effectiveness of the cat's cell-mediated immune response and which organ systems are affected. There are two classic forms of the disease: wet effusive and dry non-effusive. The form a cat develops depends on the presence of effusion in body cavities. Over time, the dry form can progress to the wet form. Historically, cats with FIP show an insidious onset. They might experience gradual weight loss, reduced appetite, and stunted growth. A persistent, fluctuating fever that doesn't respond to antibiotics is another hallmark sign. During a physical examination, a veterinarian might note depression, fever, poor overall condition, stunted growth, a dull and rough hair coat, and jaundice. The abdomen might be enlarged due to effusion and palpable abdominal masses might be detected. Eye-related symptoms can include anterior uveitis, choretic precipitates, iris color changes, and an irregularly shaped pupil. Neurological signs can range from seizures and ataxia to paralysis and abnormal behavior. Causes and risk factors. The leading theory behind FIP's cause is mutation. It's believed that FIP mutates to FIP during infection in individual cats. A weak cell-mediated immunity then plays a role in the development of FIP. Several risk factors can increase a cat's chances of developing FIP. Contact with an FIP-shedding cat is a significant one, as over 30% of cats are chronic shedders. Living in breeding catteries or multi-cat facilities can also increase the risk. Young cats, less than 2 years of age, are more susceptible. Additionally, cats infected with the feline leukemia virus, FELV or feline immunodeficiency virus 5 are more prone to developing FIP. Certain cat breeds have a higher incidence of FIP, especially the dry form. Diagnosis. Diagnosing FIP can be straightforward or challenging, depending on the form. The wet form is easier to diagnose clinically, while the dry form can be elusive. Tests like reverse transcription polymerase chain reaction, rupture or immunohistochemistry on effusion or affected tissue can confirm the diagnosis. However, there's no single diagnostic laboratory test for FIP. Differential diagnosis. When a cat presents with symptoms that might suggest FIP, other potential diagnoses must be considered. These can include infections, inflammations, cardiac diseases, neoplasia, toxoplasmosis, blood parasites causing hemolysis, pancreatitis, yellow fat disease, and panleukopenia. Treatment and care. Unfortunately, there's no cure for FIP. Treatment is symptomatic. Immunosuppressive drugs like oral prednisolone might alleviate some symptoms. Feline omega interferon's effectiveness in symptomatic management is still unclear. Antibiotics are generally not necessary. However, direct-acting antiviral drugs for FIP have shown promise in treatment and are under development. Conclusion. FIP is a complex and severe disease that poses significant challenges in the world of feline medicine. Understanding its intricacies is crucial for veterinarians, researchers, and cat owners. As research continues, there's hope that more effective treatments, or even a cure, might be on the horizon.